All right, so we just have a couple of minutes before we go into our break. We'll be breaking from 10 to 10:30. In the meantime, does anyone have any questions of clarity about these four terms that we've defined? If you have a question, please come to a mic, state your name and affiliation, and ask your question.
Hi, good morning. I'm Phyllis Arthur with Bio. Great presentations, actually. I feel very level set. Thank you. I wanted to actually just comment on the last set of systems, healthcare systems that Dr. Pratt talked about. I think that there are a bunch of different public health systems, but I would particularly call our attention to immunization registries as a unique system within that last bucket you presented. I do think those systems are actually extremely timely. They have both adult and pediatric in most states, and a lot of them are right now used by many states for querying data all the time. So I think IISs are sort of a unique bucket that we might want to consider their interoperability. There's a lot of interoperability programs going on right now in the U.S. government to make them talk to each other more frequently. They also talk to EHRs. So I'd call them out of that last bucket a little more uniquely, because sometimes we may be responding with vaccines, and those systems may actually be very helpful.
Alice, any questions of clarity about these four areas? The concept of operations, electronic health records, big data, unstructured data, and clinical trial networks or clinical networks. You have a question here?
It sounds like it's on.
I have many questions, but not enough time to ask them all. But in terms of the medical health records, electronic health records, we've been hearing this issue for eons, and it's far beyond responding to emergencies. In computer science, the reason we all have laptops and desktops is because of the standardization of the operating systems. So we had many at one time. Now you have, how many people have a Mac or an Apple product? How many people have a PC product? Anybody uses Unix? Anybody use anything else? Not much, as you can see. That's why we have such a ubiquitous value in PCs. With electronic health records, the problems you've stated affect so many. How can we solve it? Is there a solution on the horizon? I think standardization is the issue. How do we affect that?
Well, it's not an accident that we are where we are. There are really good reasons for it, and we'll need. I think we'll need a variety of solutions. That is, first of all, the issue isn't just standardization. The issue is EHRs were built to deliver care to one person at a time. And we're now asking, and we're here to talk about how we extract information about populations from them. So there's a non-trivial problem of, even when we get the information out, how do we use that? It may be bigger than the all of us to say, at least us in this room, to talk about what the solutions are for both standardization and sort of free accessibility of the data. I'd be happy for us to list the things that we need, and then we can hand them to Carmen, and she can solve these problems for us. But I just want to say, this didn't happen by accident, and it's not an informatics problem. It's an information problem, but this is not something for which we need sort of deep thought on clinical informatics to solve, in my view.
I think we're going to need a culture shift, because as opposed to the PC environment, we're talking about patients' health and the protection of patients and their families with that information. So you have a push on one side for standardization, which is entirely appropriate, and you have a push from the other side, which is patient protection and privacy, which is also entirely appropriate. There are other nations that have solved this through a unique medical identifier. It's certainly something that we could do in the States up to this point. Thank you, Richard. We've chosen not to, but there's certainly an opportunity for us to be able to do that, and that may require some legislation. I think if folks ultimately get concerned enough about the threat, they'll understand the importance of standardization. But right now it seems like there are too many forces opposing, so we're kind of stuck.
We'll take one final question, and then we'll move to break.
Thanks. Greg Burrell, Director, Strategic National Stockpile, Centers for Disease Control and Prevention. One of the things that interested me is when you talked about the study that was done about mining Twitter for data. And I think it's very interesting, and I'll take a step back in this whole use discussion of who is going to go get mass prophylaxis materials or whatever and really use them. We've done some opinion polling through Harvard and other sources that suggest to us people are going to go pick up medicine or accept medicine and then wait to see if they get sick. I think it would be interesting from our perspective to see how dispensing is progressing or how receptive people are to taking what is being dispensed if we could start to mine that social media data on the fly and see if we're seeing people saying things, well, I got it, but I'm not going to use it. I'm afraid to take it. I don't think I really need it. So just to step back from that use, and I think we get caught in the use issue around what happens after they take it. But I'm a little concerned, too, about can we get them to even take it to start with?
Yes, and so one of the, unless, I don't know how many people in here tweet, or if you've carefully read the terms of agreement, but anyway, on a daily basis, Twitter provides a public sample that can be downloaded and freely used in a retrospective manner, and there are also approaches where you can use an application programming interface to get real-time data. And so we can think about things. Not all Twitter data is actually unstructured. Hashtags would be considered structured, and so they don't require much wrangling to be able to do that. But in fact, it is a good, and there are tools that explicitly do sentiment analysis, so that can be useful for kind of getting a sense of what the public is thinking and those kinds of things. So there are existing tools, there are existing platforms. It's just thinking about what are the structures that need to be in place to be able to use it effectively, and realize it's not like something that solves all issues, but it does give you a sense of a portion of the public. And often with different types of technology, we worry about issues of health equity and digital divide and who has access to it. I mentioned that at least at this point in time, Twitter is a social media that's actually used more by Hispanics and blacks than non-Hispanic whites. So it may get out to both gather some data about some populations which are a little more difficult to reach at times. And because the technology is so similar to text messaging, there's not a lot of literacy required to really be able to use it. So I think it's something to discuss about what the potential is and where in what we'd need, in anything we need, we often either need training, we need tools, or we need services that are developed to be able to handle this. And so just thinking about capacity in that aspect.
Thank you. I'm sorry, we're going to have to take a break. We're already at break time, so a round of applause for our definitions panel. And we're going to take a break now. We'll convene again in this room at 11 o'clock, and I would encourage folks to fill in the middle. Let's come together.